Most people who have looked into knee replacement know that it's usually a painful surgery to recover from, but something that's less obvious is how the surgery affects your sleep. In reality, the majority of people who have had the surgery report difficulty sleeping during the recovery. If you've had your knee replaced, you probably know exactly what I'm talking about. You're exhausted, your body needs rest to heal, but no matter what you do, your amount and quality of sleep is terrible. Even worse, poor sleep has been linked to more pain, slower recovery, and lower satisfaction with your knee replacement. But there is hope. There are proven strategies that can significantly improve your sleep, and I'm going to share the most effective ones with you here. By watching this video, you'll understand exactly why sleep is so difficult after knee replacement and what specific steps you can take to get better rest. Hi, I'm Dr. George Bounajem. Some people call me Dr. B, and I'm a board-certified orthopedic surgeon. After residency, I completed training in hip and knee replacements at Harvard Medical School. Knee replacement is the most common surgery that I perform, and I know that sleep is one of the most challenging and frustrating parts of the recovery. So why is sleep such a problem after knee replacement? Like you might expect, pain is the most common reason. Your knee has undergone major surgery, and the pain often gets worse when you're lying still at night and your mind isn't distracted. Staying in one position while trying to sleep tends to worsen stiffness and aching in the knee. Pain and poor sleep form a vicious cycle, and research shows that lack of sleep leads to feeling greater levels of pain. That worse pain leads to even worse sleep, and the cycle continues. But pain isn't the whole story. Anxiety and stress about your recovery play a huge role too. Patients often report concern about damaging their new knee, anxiety about their progress, or just feeling overwhelmed about the experience in general. This mental stress can keep your mind racing when you should be winding down. Lastly, your medications affect your sleep in ways that you might not realize. Pain medications like opioids, while helpful for managing your post-operative pain, can actually disrupt your sleeping patterns. Research shows that opioids reduce your sleep efficiency, which is the amount of time that you're actually asleep while you're in bed. Even if you do manage to sleep, these medications reduce the time that you're in deep sleep and rapid eye movement sleep, or REM sleep. These are some of the most important and restorative phases of sleep. This creates another frustrating cycle, where you need the medication for pain, but they're also preventing the quality sleep you need to heal. So how long do these sleep problems last, and when can you finally look forward to better rest? Well, even though the first few nights after surgery can be some of the worst, the additive effects of poor sleep over the next few weeks can lead to weeks 4 to 6 being some of the most challenging. Most studies show significant improvements in sleep by 3 months after surgery, and these improvements continue to 6 months and beyond. In other words, even though sleep tends to be worse in the early postoperative period compared to before surgery, most patients find that sleep eventually becomes much better than it was before surgery. Now, I know what you're thinking. 3 months is a long time to deal with bad sleep. So, other than building a time machine, what can you do to improve your sleep now? First, optimize your sleep position. Sleeping on your back with the operative leg elevated helps to reduce the swelling in the leg, and also helps prevent the knee from getting stiff in a bent position. Second, manage your pain proactively. Consider taking your prescribed pain medication 30 minutes before bedtime. Check with your surgical team first, but if you are able to take medications like Tylenol and anti-inflammatories, you might be able to take these in addition to your opioid medication for added benefit. You might also want to use your ice packs or cold therapy device before sleeping to help reduce inflammation. Third, create a sleep-friendly environment and routine. Keep your bedroom cool, dark, and quiet. Avoid screens for at least an hour before bed, and develop a calming routine like stretching or reading. A consistent routine helps signal to your body that it's time to sleep. Fourth, try relaxation techniques. Deep breathing exercises, progressive muscle relaxation, and meditating for 5 to 10 minutes can calm the mind and help improve sleep. Finally, I should mention that some medications are used specifically for sleep, like the over-the-counter medication melatonin and the prescription medication Zolpidem. Studies overall don't show a significant improvement in sleep after knee replacement with melatonin, although some studies show a small improvement in the first few days. There is some evidence that Zolpidem can help improve sleep after knee replacement, but some studies show a higher complication risk with it. It is also a sedative and can increase the risk of drowsiness and falls, especially in combination with opioids. As always, ask your surgical team before trying any of these medications. Sleep challenges after knee replacement are incredibly common, but they can improve with the right strategies. Even though it's obviously easier said than done, try and avoid getting frustrated with yourself on nights where you can't sleep. We all know that the more you try and force yourself to sleep, the more awake you become. If you find yourself staring at the ceiling wide awake at 2 in the morning, try to take some comfort in the fact that virtually everyone who has a knee replacement goes through something similar, and it does get better with time. If you're considering a knee replacement and you haven't been scared away by the struggles that we just talked about, here's my video on how to tell if a knee replacement may be right for you. If you found this to be helpful, please click the like button so I know to keep making videos like this one, and leave me a comment down below on what I should cover in the future. Stay well, and I'll see you in the next video.